My name is Therese Pilonetti. I do work at the State Health Department. I'm in the Division of Environmental Health and Sustainability, and what I do there, one of my roles is to oversee the retail food program, and we'll talk about what that means and what I do, what my colleagues in my division do as well, and then some of the other state and federal agencies. The other thing I wanted to talk about is food safety in general. What's the burden of foodborne illness in this country? I also want to get into some of the barriers and things to think about when you're starting to do more local foods and foods from scratch in a school setting. So the first question I have any of you felt like you ever got sick from food? Ever? Thought you had a foodborne illness? So probably most of us, right? At one point in our lives thought we got sick, or maybe a loved one. So when you were sick, were there other people sick? Was it just you? Do you recall anything like that? When you have more than one person sick and there's a commonality for a food that you ate, that's a really strong indication that it could be from food. Another thing that people tend not to do, obviously there are reasons for that. We don't always visit a physician when we're sick. What happens then is that we don't get a diagnosis. That diagnosis is then not reported. So a lot of foodborne illness is very underreported, and so our numbers are best guesses, but we do feel that it's a very big burden. So what is the impact? How many people do you think get sick in the U.S. every year from foodborne illness? Any guesses? B? You guys are sharp, yeah. 48 million. And you know what that equates to? 1 in 6 Americans every year. That's a lot of people getting sick. And when you think of 48 million people getting sick from foodborne illness every year, that could mean all of these things easily. I mean, it affects our higher cost of healthcare. It's, work time, school hours. There's so many impacts that happen from those people getting sick from food. And to compound it, there's a lot of people that do wind up going to the hospital. 128,000, and sadly, 3,000 people die every single year of foodborne illness. If we were to decrease the number of people getting sick from foodborne illness by 10%, we would keep 5 million people from getting sick every year. It's a pretty big impact. Just one case of E. coli 0157 that's fatal costs $7 million. In fact, salmonella alone, without fatalities, costs $365 million every year in this country. So this is just a list of some of the common outbreaks that have occurred recently, over probably more like the past 2 years. And some of these I'm sure will be very familiar. Jensen's Farm, we're going to get into quite a bit more of the details of what happened. But then there's a whole host of others. I mean, there's been peanut butter thrown in there, eggs, lots and lots of things going on in recent years. So this is also another list of foodborne illness agents that wind up in food and that make people sick. Listeria seems to be on the rise. I think E. coli and salmonella are really big hitters, and we'll kind of look at some pie charts that show us, what illnesses are most prevalent. This is an example of what kinds of food that have been traced to a single source, like if it's an outbreak and we find exactly what that food was, over like a 5-year period, what were the most common foods. And leafy greens is high up there, as are fruits and nuts. Dairy, beef, and poultry are very high as well. And by vine, we mean like tomatoes, cucumbers, those sorts of foods. So a lot of the stuff we're talking about bringing into schools happen to be a pretty big source of foodborne illness if we're not careful. This is a little bit older data, but it just shows when you do look at fresh produce, what are the issues and where have we traced outbreaks to exactly. Salad bars is really high right here, but I think that the trend is more towards leafy greens right now, and fruits, and sprouts are always a heavy hitter. As I mentioned, Salmonella, E. coli are really the highest amounts of illness that we see every year. And this, I'm sorry, this isn't that easy to see. It's 9% of the produce that's imported causes foodborne illness. 75% is all coming from this country. So it's not to say, all the food is coming from outside of the country that's making us sick. It's things that are happening right here on our own soil. Notable Colorado outbreaks. Probably a lot of you guys remember the salmonella that was in the water. We do consider that, a waterborne outbreak. We've had sprouts, peanut butter, and again, the listeria, the eggs were also here in Colorado as an issue. So what are the issues? What's causing all this foodborne illness? When we look at the data, the epidemiological data, we really find that there are 5 major causes, and most of them are very related to behavior, employee behavior, and hygiene, those sorts of things. And so I'll list them out for you here. Number 1 is poor personal hygiene. So hand washing after using the restroom and those sorts of things are very, very tied to foodborne illness. Also improper holding and time temperature abuse issues, which is also could be related to behavior. Sometimes it's contaminated equipment. We're not cleaning things in between uses. Maybe we're preparing a raw animal product and then something that's not going to be cooked. That's what we consider cross-contamination. Sometimes things aren't getting cooked thoroughly enough. And then also sometimes it's an unsafe source. It could be a producer that hasn't followed the best practices or regulation, and they have some issues going on. So this is a little bit closer look. I know Jensen Farm was very much in the news for several months, but it was discovered that cantaloupe was the issue, and Jensen's Farm specifically was asked to recall their cantaloupes on September 14th of last year. And then it took, because people get sick for 2 months after they've eaten a food contaminated with Listeria monocytogenes, there were still people that were reporting illness for 2 months after that recall. But even still, because of that incubation period, we do know that we stopped the outbreak from that recall. Total of 29 deaths. And people that had symptoms, 99% of them did wind up hospitalized, but there were probably a lot of people that either had asymptomatic symptoms or very mild symptoms that they didn't visit a physician from. And as we've all heard over and over, I think, it was one of the deadliest outbreaks ever to occur in the U.S., at least in the last 25 years. So there's some real basic principles that everybody can follow. And food safety, it's true throughout farm to fork, that there are things that can go wrong and things that we need to all be doing right and thinking about. And these are all tied back to those 5 foodborne illness risk factors. So washing hands, good personal hygiene in general. Another key one that wasn't in the top 5 is never prepare food when you're sick yourself. For anybody else, because that's a very easy way to get foodborne illness to spread quickly. Always want to be cleaning equipment in between uses, like I mentioned, between raw animal products and cooked animal products, cooked other products or products that aren't going to be further cooked. And then washing produce, also keeping perishable foods at safe temperatures. Some other things to keep in mind are, pets and animals, livestock, keeping those away from food preparation and even agricultural areas, safe water practices as far as using potable water for cooking and cleaning. There's lots of different things, but those are the major ones. In Colorado, we've identified food safety to be one of our 10 winnable battles, and those are our priorities for public health. And it's actually one of the 10 winnable battles for CDC as well. So nationwide, we're looking at that as one of the top 10 things that we should be doing a better job of and we can improve upon. So at my office, what I do is I oversee the retail food inspection program. And so retail food is really defined. It's restaurants, grocery stores, and also kitchens in schools and some other institutions. And then just wanted to let you know about how many food establishments there are in Colorado. It's quite a high number, 20,000 facilities statewide. So the statute in Colorado, the Colorado Revised Statute, is what gives us our authority to run this program. And so basically it gives us the authority, it makes us the agency for certification of food protection. It also allows us to regulate retail food establishments, promulgate regulations, and enforce those regulations. This is a specific section that talks about developing those minimum standards, and that basically is this document right here. This is the retail food regs. It's actually quite a bit more than that. There's a lot of, material and guidelines also incorporated in this. About half of it is actual regulation. But that's what we go off of. In ensuring compliance, there's a whole lot that goes into that. We do routine inspections. Those are unannounced, typically. We follow up if we find critical violations or foodborne illness risk factors. And then we can also voluntarily condemn food. And basically what that means is if we find an unsafe condition, handling practices, food temperature, something like that, we ask the establishment to throw the food away, and we try and make a case for why they should do so. If they refuse to throw the product away, we can then use what's called embargo. An embargo is basically we lock it up, we put tape around it. It's basically our property. It can't be moved, touched, discarded, anything until we get a court order to then remove it. So it's, that's not, nobody really wants to go that route. If they have a cooler that's not working, do they really want us to wrap it in tape and say, do not touch, this is dangerous? So it's usually, voluntary condemnation is much more appealing. And it's typically they're throwing away a batch of something. The other things that we can do is we do what's called a compliance schedule. We go in and we work with the facility to say, this is an issue, we need it fixed by a certain date, what can you do? Meet us halfway, and then we put that all in writing and we hold them to that. We can also do things like on-site training where we go in and we really focus on the issues that are a problem in that establishment and do a lot of hands-on training. We do inspections that are specifically focused on problems that they have. They may be critical items, foodborne illness risk factors. We can also ask them to voluntarily close. And a lot of times that's tied directly to what's called an imminent health hazard. Maybe they don't have hot water. Their hot water heater went out. Or they had a sewage backup in their basement, or something that's kind of a egregious thing that could easily lead to a lot of people getting sick. Another tool we have, we don't use a whole lot, is a civil penalty, and that basically means we assess fines based on violations that occur over and over and over. Over the last 5 years, we've had less than 20 establishments, that have been suspended. Their license, they've been suspended to say you have to close for a week and clean this up, or maybe you have to close for 6 months because that's your penalty. But that's very rare if you think of that whole broad spectrum of how many facilities there are in the state. So in my office, what we do is, 1, we promulgate the regulation, and 2, we cover 10 counties out of 64 and about 900 facilities in those counties. So we're based in Denver, and we send our inspectors out for usually a week at a time to do the inspections. They pretty much live there for a week, do as many inspections as they can. They're doing follow-ups and all these other activities that I mentioned. And then we also do inspections on a risk-based basis. So some of them are more frequent inspections, once, twice a year, for example, if they're a high-risk facility. We do about 10% follow-up on that number of inspections. We also condemn we condemn food about 100 times a year, roughly, if you look over a span of time. And that typically runs about $1,000 total in those 900 restaurants. In a year, we typically do 100 to 135 civil penalties, and some of those are for people that started a restaurant without ever getting approval to do so. So they didn't submit plans, they went ahead and opened. We fine them by maybe doing a drive-by or getting a complaint, for example. And then at that point, we would need to assess a fine, make sure that they go through the proper procedures. And fines total is typically $1,000 to $3,000. Not a lot of money. The fines are anywhere from $250 per incident to a max of $1,000. And we typically don't go with a max. So it's not a really big hammer, if you will, and it takes a lot of resources. So we do try and do a lot of the other things that I talked about as far as the training and follow-ups, those sorts of things. So what about the other 54 counties? Those are all covered by local public health agencies, and those agencies have been delegated authority to do the work of inspecting and enforcing the retail food regulations. In doing so, there are 33 counties, local public health agencies that cover those 54 counties. So some of them are district county health departments. They do about 30,000 inspections a year, so 30 times what we're doing. And that we also all together respond to foodborne illness complaints. So we're all working, to try and investigate, stop them. We respond to recalls, that sort of thing as well. But you can see we're really more in the business of providing a technical support to these local partners than we are to doing the work ourselves. So that's kind of how we see our role. One big issue with having so many different agencies doing inspections, let alone so many inspectors doing all the inspections, is uniformity, and to really apply the regulations in the same way. This is something that we really hear a lot from industry, and we're charged with ensuring uniformity statewide. So it's a major, major issue that we're constantly dealing with. And some of the things that we do, we put on training courses 4 or 5 a year in the retail food program, and we typically move around the state and do regional trainings. We just launched a whole online training that anyone can take through CoTrain. If anybody's interested, I can give you information on that. We do standardization, so we're going out in the field and we'll shadow an inspector and look to see that they are asking the right questions, looking at the right things, writing up the right things. We have what we call our local assistance program, where every single county has a liaison that they're assigned, and that person is their go-to person for all kinds of questions that they could possibly come up with. And they're supposed to be available within 24 hours. So if they get a phone call, they need to get back with them within 24 hours. So we really try our best, to be there to answer questions, to help them through issues. We also encourage our local partners, and we do as well, meet what we call the FDA Voluntary National Program Standards. And it's 9 different standards that really say you have a good and effective retail food inspection program. And this is being done nationwide, which is really cool because we can all say we meet, 6 out of 9 standards or 3 out of 9. And that gives us a measure of, what we're all doing throughout the country, which is really nice. And then we also do what are called program assessments. We go into 3 or 4 counties every year, and we look at their entire system. We're looking at inspection records. We're going in the field with their inspectors. We're looking at policies and procedures, the whole gamut. And we typically write a report that runs about 30 pages to tell them what they're doing well, what we saw, what they could improve on, make suggestions. So a lot of work that we do has to do with ensuring our uniformity. We have another program a colleague of mine, Susan Perchini, oversees at my division, and that's for manufactured food and wholesale food. So what her program does is it oversees facilities that prepare food for other retailers. So they're wholesaling to those facilities. Any foods that cross state lines are sold in interstate commerce are the jurisdiction of FDA. As a generality, it depends sometimes if it's what kind of meat or how much meat it has in it, then that could be USDA. But what we do is we do our inspections under contract with FDA. So they contract with us, and then we go out and do inspections for them in our area, statewide. And we do about 250 of those inspections a year. We also take produce samples, about 20 a year. And then what we do, we also go into about 5 establishments every year, and we do a comprehensive sampling, and we swab 90 samples throughout, usually it's like a produce facility or something like that. It could be any kind of wholesaler, actually. So we're trying to get a really good idea of, what is the level of contamination, environmental contamination in that facility. If those results come back positive, it could result in a recall, depending on what we find. And of course, we also, through that program, deal with a lot of food recalls and foodborne illness outbreaks. So uniformity is also important, but we do have a much smaller universe. We're only talking about 4 or 5 inspectors, and they're all based in our office. It's a little bit easier to manage that, but we do still have our inspectors in that program certified by FDA. And then we also have specific people that do work in these more challenging areas: seafood and shellfish, juice, acidified foods, which is like canning of foods, and jarring of salsas that are shelf stable, for example. And then also dietary supplements is another one that can get kind of complicated. So I wanted to talk a little bit also about responding to food recalls and how we go about that. We basically get most of our recalls from FDA and USDA. We typically get several every single week. And what our responsibility is to find out, is this a food that made it into Colorado? That's one of our first determinations that we make. If we did find out it came to Colorado, then we need to do a little bit more research. Where did it go exactly? We need to notify the distributors, consumers. A lot of times we'll do press releases, for example. We want to make sure and get that word out. So the food recall response, basically, this one was an interesting one. A lot of people remember this recall having to do with tomatoes, but in reality, it was traced to jalapeno peppers, and it was our state lab that made that determination. But unfortunately, it really affected the tomato industry before we figured it out. But it was just a really interesting outbreak, because I think jalapenos, people don't typically just eat a jalapeno by itself. It's mixed with a lot of things. So it was really hard to do the trace back in that situation. We also have another program overseen by Paul Klug in my office, and he oversees the dairy program. He does work with dairy farms, milk plants, and he also works with haulers and tankers. And he's doing lots of inspections twice a year for every single dairy farm in the state, and also I think 4 times a year, or it must be more often for milk plants. But that's another program that we oversee. Another thing that we do kind of as a team is we look at intentional acts of contamination, so what we call food defense, and we want to make sure that our food supply is safe from, terrorism or whatever it may be that someone might want to do to cause harm. And this is just an example of some outbreaks that were, some of them are definitely related to an intentional act of contamination. And the really frightening thing is, there was the Chilean grapes cost $200 million, but really they only found a couple of grapes that ever tested positive. So, it's just that the impact is really fear, and that's what the terrorists want to do, is to, really hit an industry hard, and the economical impact can be enormous, even with a very, very small incident. This is Tommy Thompson's quote. He used to be the Secretary of Homeland Security, and he's basically saying he doesn't, for the life of him, understand why the terrorists haven't attacked the food supply, because it would be so easy to do. So that's kind of something we always keep in the back of our minds, this is really important, and we need to be thinking about keeping agricultural, assets protected. It's pretty easy to get on and off a lot of properties like that. So something could easily happen, and we want to get that word out and do the best that we can to control something like that. In 2011, just last year, we did a very large tabletop exercise in Cherry Creek School District. We worked with hospitals, emergency planners, epidemiologists, other agencies like USDA, FDA, and basically walked through this full day exercise where we had a food source. I think if I remember right, it was chicken nuggets that were intentionally contaminated in this scenario by some, terrorist group with Clostridium botulinum, which is a very, very deadly agent that produces a toxin as it grows, and it's one of the deadliest substances on earth. So it was really, really eye-opening to think of, if this were to happen in a school district, just the absolute devastation. I mean, it was very sobering to go through this exercise, and really, really eye-opening. We hope to do more things like this. We are working with dairy plants right now to make sure that they're aware of these issues, making sure they know who their suppliers are, who's coming to their farm to get milk or drop off supplies. Do we know that they're really legitimately there? Did they check identification? Do they have security cameras and gates and those sorts of things? So there's a whole lot I think, of improvement that we could do. In July, we're going to do another very large tabletop exercise in Grand County in Winter Park, I believe. And we're going to test what we call our food emergency plan. So we have this exercise in a box, kind of, and it's going to have this whole scenario that plays out with little vignettes from news clips that's all been, they're all actors or whatever, but as this story unfolds, we have to react and do certain things and connect with different people, which will really help us build relationships and determine if we need to change our plan, if it's working okay. So hopefully there'll be some really great outcomes from that. Some things that I also wanted to talk about are just some considerations for farm to school. We want to make sure that the foods that we are getting in the schools are safe, regardless of where they come from. So some things that you have to consider is that foods do have to be from an approved source. The only exception is produce, because there is no approved source. You can grow raw, uncut produce and sell it to whomever without being licensed or registered. But anything else has to be from a registered or licensed source. So what does approved mean? It depends on the food. It depends on the commodity that we're talking about. If it's any food that's processed, like from a wholesale food establishment or even a retail food establishment, that establishment has to be licensed or registered with our office. So you want to ask those questions. If they're eggs, they need to come from a source that's inspected by the Colorado Department of Agriculture. If it's a very small producer, then they might have to ask for a voluntary inspection, which, from what I understand, can be difficult because of resources. But unless they go through that voluntary inspection program, they're not considered an approved source. And that's the way it is right now. I don't know if there's talk of changing that. That's not my particular program, but it's just something you should know. Meat and poultry need to come from an FDA or USDA approved source depending on the species. And there can be some indigenous species that can go through a voluntary inspection program. Those are things like buffalo, quail, deer. Anyway, but most things fall under the mandatory USDA and FDA inspection programs. Seafood and juice have additional requirements to be considered an approved source as well. So with produce, the question keeps coming up, how do we know we're getting produce from a safe supplier? And I think there's a lot of things going on right now. I think a lot of them are very good. We want to see more local produce in our schools and just in general. I mean, it's great to support our local farmers, and we all want to do that. So I was trying to look at the good agricultural practices and kind of pull out some of the issues that seem to be, really important that we all need to be aware of and able to ask these questions. So one of the things, these are a list of the things that I pulled out of a guidance document on the gaps. And, we want to know, are the fields accessible from livestock, from pets, other animals? Do they have any control over birds, chickens, whatever may be getting into the fields? What kind of water do they irrigate with? If they're using anything other than potable, like municipal water, if it's well water or surface water, they should be testing that routinely, and those are all set out in the guidelines. If they are using water that isn't considered potable, then there's certain ways that they need to irrigate. For example, they drip irrigate rather than overhead spray. There's also times of day that are important to be watering versus other times to keep the bacterial loads down. Another thing that's very common is composting with manure, or using manure to spread and fertilize soil prior to planting. And there's parameters of when that should be done, and then how soon you can actually harvest foods like leafy greens. And I think it's 120 days minimum. You have to wait that long to ensure that the bacteria load is low. Also pesticides, and this I didn't find a whole lot in the good manufacturing practices, good agricultural practices. But, what we've always said is if you want to grow your own produce or you want to get it from a supplier, ask the question, what do they do with pesticides? Are they applying them, per labeled instructions? Are they mindful about it? How much do they use? So asking a lot of those questions, I think, will really help you get a picture of if this is a supplier you should go with or not. Any other thoughts? Do you guys have other questions you can think of that you might ask a supplier of produce?
Therese, I have a quick question for you. I've struggled with finding out, you had mentioned that the water source, and I couldn't find out real regulations for how often to test, and then what's acceptable, what's not acceptable. Mm-hmm. I've really struggled with that.
Okay, I'm going to repeat your question. The question was when to test different sources of water and what the criteria would be for that testing result. And what I was able to find was, I think it was from Cornell University. It was a really good document that was only about, 28 pages versus how long the actual gap is. I found it extremely helpful, and it did talk about parameters for well water, I think was 3 times a year, and I believe surface water was 4 times a year, and then they did have coliform forming unit, maximums. And it's all recommendations, but I did find it there. So I would look there. Okay, so that hopefully will help. Any other thoughts of what you might want to ask? Organic is always good. Maybe that's not reasonable. I don't know how many organic producers there are in the state, but
the other thing we look at is personal hygiene habits of
perfect.
The workers and the whole running water, wash hands.
Exactly. Restrooms available.
And all of that stuff.
Exactly. I think you had a comment.
I was just wondering, since there isn't like a food source for produce, if you had a grower that wanted to deliver to you, it doesn't have to be in refrigerated trucks or anything like that, and you just take it at risk and wash it and you hope for the best.
Right. And washing produce is going to be really important too. And if you have a hard rind fruit or vegetable, it's great to use a clean scrub brush and to clean that scrub brush really often. Run it through the dish machine is a really easy thing to do. Oh, and this is just a note, Listeria monocytogenes can live in the soil for up to 3 months. Maybe longer, we don't know, but that's what happened with Jensen Farm, I believe. Yes?
I have a question about Listeria. Was Jensen's Farm, for instance, was it on the outside of the bones or was it in the flesh of the bone?
All of the testing was done swabbing the outside, but that doesn't mean it wasn't in the inside. It's not conclusive because the second you cut it open, you're introducing the bacteria. Nobody has devised a way to make that determination.
Okay.
So
Even if they washed?
Exactly. You know, and I don't know, I didn't see the data on the epidemiology as far as whether or not people reported washing their cantaloupes really well that ended up really sick. But that would be really interesting to know.
I bet they didn't wash their cantaloupes.
Yeah.
Because a lot of people have no idea that they should wash all of
Yeah.
them. And they should wash things that live in the dirt.
Well, then it would have been an anaerobic bacteria down there then, right? If it were in the inside. The melon plant, I mean,
You
it
know,
doesn't
I
make
don't
sense to me.
know. I don't know. I mean, there's a lot of talk about how sprouts get, you know, as they're growing and they're pulling in that water, the bacteria is following the water directly into the inside of the sprout. So that's why they're so difficult to you're not cleaning them because it's inside. And there's other thoughts about cut produce and should you wash before or after cutting, and because of this I can't remember what they call it, but it's when water gets sucked into that piece of produce or cut melon or cut leafy green, does it bring with it the bacteria that could be present? And I think there's a lot of research that still needs to be done, but I mean, it's really interesting to think about. And I mean, we are right now starting to recommend wash before you cut because we just don't know the answer. So I wanted to also touch on what might be some barriers to think about when you start doing more foods from scratch. And basically, you know, if you're a kitchen that always did chicken nuggets and frozen pizzas and that sort of thing, you may not have all the equipment that you would want to have if you're going to be doing, you know, large volumes of food from scratch. And some things that I could kind of come up with were food preparation sinks are a big one if you're going to be washing a lot of produce. For example, you're supposed to, according to our regulations, which apply to schools, you're supposed to have a designated sink to be washing your vegetables and preparing foods. And those typically have to be set up a certain way, drained a certain way, to make sure that the sink is safe and designated for that only and not subject to sewage backup and that sort of thing. Another thing is, you know, do you have enough equipment for cooling? And if not, what possibly can you do? I mean, some schools have, you know, ice machines, and maybe that's an option. But we have to be creative and think about, you know, what can we do in this setting to make sure it happens safely? And we don't want to be the ultimate barriers, but we do want it to happen safely. So just be thinking of this. Work with your local county or your state health department up front, early on, you know, just to kind of work through these things. I think that's a good idea. Another thing is, you know, a lot of these places that are doing much more from scratch cooking don't have the right equipment for pulling heat and grease and cooking vapors out of the kitchen, so that can cause issues, cleaning issues and, you know, temperature issues, all kinds of things that can even cause your cooling units to not run well. So, you know, all of this stuff can kind of snowball, and before you know it, you're in a situation that's really challenging and can be very expensive to correct versus doing right in the beginning. So just basically work with your local public health agency or our office if you happen to be in one of the 10 counties that we oversee. And that does include the San Luis Valley. I know someone was here from there. Okay, yeah, that's right. So anything you guys want to talk about or ask about or discuss or throw out there, we could all kind of chew on. Go ahead.
I was just wondering what other people had in terms of questions or confusion from what you may be seeing on the local level, or any questions about the regulations, or whether having things in a fact sheet or some form, you know, would be helpful to you, because it can be a lot to go through. That was just a general question I had as a group.
One thing we're planning, we get not very much, but about $5,000 every year for food safety task force work. And what I want to do is really revamp that, and I want to get local agencies together on a regular basis to do really task-oriented, you know, action item sorts of things. And one of the things that we want to really work on is figuring out a flow chart or document that will tell you, I want to start doing eggs or honey or, making bread, to say what exactly you need to do, who you work with, what it's going to cost you for a license, what are the parameters, and link you back to all the different resources that you would need. So we find we need that ourselves, because every time we get a phone call from somebody with a potential idea, we end up struggling sometimes to get them the right answer. So, just for ourselves, it would be important, but I think it would be helpful for your group as well. That's something that we can take other issues to. If you guys have things that you think would be helpful, I really want to meet the needs of, schools and local health agencies. You have a question?
If you're planning on buying things locally that aren't produce, and you get questions about the requirements of that company, because we have a couple local companies that want us to purchase from them, what are the criteria? What things do we have to look for as a school or school district in order to make sure that we hit all the things and we don't have any issues with the health of our kids? Because no matter where we get our food, the most important piece is healthy kids.
Absolutely.
So is there like a checklist of, buy local, but here's the items you have to look out for, especially if they're making bread or honey or whatever?
Not something comprehensive that comes to mind, but that's exactly the sort of thing that this task force could easily work on. If there's a need for that, then absolutely, that's something that we can work on. But Susan, you and I were talking about a work group that was putting together kind of a crosswalk of different regulations for different food products. Maybe that, I don't know if that would meet the need or the...
Yeah, well, that's something that I was talking about in my presentation about the law and policy, just looking at the regulatory framework and figuring out who are the entities involved in, for example, buying local, and what are the different regulatory requirements and when. And it also relates to Jane Brand's presentation right now about geographic preference in terms of how to give preference to local producers. So part of it's safety, and part of it's the law of local preference by the USDA. So we're going to be doing a series of fact sheets and documents about that can feed right into your task force, Therese, too.
Great, okay.
So that's going to be in the works this winter. Sure.
Maybe what you were getting to, and one of the things I struggled with, it took me over a year to figure out that farms and produce company, there was no regulation on it until it got to a processing unit.
Yeah.
But maybe something that would be helpful, I would find real helpful, is, I've read through the documents and the gap and all that, but working with local farmers and everything, you touched on big things that I got out of it. I mean, it's the water source, it's the manure that's properly worked and aged and all that, and then the personal hygiene habits and all that. But maybe, some checklists like that, or how to work with folks that you want to work with, or if they're knocking on your back door. Because what I'm running into is the farmers that we want to work with, they want to work with us, they are not GAP certified. And they don't even know how to go about that. And, I can start pointing them in the right direction, but I don't have all day to do it.
Right.
Yes.
Therese,
My farmer piece is good. I just, I make all of my staff do survey every year, and I make them follow those rules, wash your hands, wash your hands, wash your hands. Since the farmer piece is good, I got that piece down. What about the little local manufacturing places? Like the local bakery that wants me to buy their bread. I mean, how do you...
But they should have
They should be licensed. They should be. And, for the most part, a lot of counties now are posting inspection information directly on the website. And if they're not, everything is subject to Colorado Open Records Act. So, if you said, gosh, this they have great bread, it tastes wonderful, but I'm curious about their regulatory compliance, you just go to the agency that oversees them and said, hey, give me their inspection results, and you might have to pay a nominal fee, based on per page or whatever. But
this summer, and they actually had it at the restaurant separated. So A, B, I mean, that's right there in the
Yeah.
bottom of the door.
Yeah.
You don't say, forget it.
New York does that too.
Yeah,
A, B, C,
that
D.
was awesome.
We have a lot of pushback from our restaurant association. They don't want us to do that, but
They don't want us to know.
I can kind of speak to that piece. In Jeffco, we've done a lot of Colorado Cloud, sourcing local, working with small processing facilities, some large. One of the things that we've determined is they do fall under all of the guidelines of health inspection, but then I myself go ahead and do a little inspection myself. And you know, I'm looking at things. The other thing that we also find out is when they are sourced by a large vendor, like your US Foods, your Cisco, they have a certain obligation to meet their HACCP compliances too. So if they're carried through a larger vendor like that, and they have all of their HACCP documentation, chances are they're going to be okay. But I go the next step and go and, you know, look around. I mean, certainly if I see things that are unacceptable that we would say in our school kitchens, and the same kind of goes for them, and maybe that's something we don't control over.
And see, you know, I understand the hassle thing for US Foods because, you know, we do the same thing. We get stuff that way as well. My concern is, yes, they might have a storefront and they might be okay through Larimer County, but where are they getting their stuff?
Well, and a lot of the smaller companies, they maybe don't do as well of a job at tracking that, but there are some that they're realizing they want the business because schools and things are big business, and they're trying to get to the point that they have the controls in place. Harvest Food Bakery, for example, have done a really great job. They have everything logged in so that when their products, their flours, their oils, whatever, hits their dock, it's registered in. Marcos is another processor the same way, so that at any one point, if they have that recall, it goes out to everybody that purchases the products. You're going to have mom and pop that may not be, and that's just a choice that you have to make as a work.
We used a mom and pop pizza place several years ago, and they passed the health department, and they had some issues with the health department was working with them, and we fired them because I went and saw the facility. There's no way. There's no way that you can come to half the standards that we do in the school.
We have really high standards, a lot of people don't know that.
They don't, exactly.
In our community, I think eventually we're wanting to help support farm to school in a way by having like a local food distribution center so that farmers, small producers could be sort of selling their food to this distribution center, housing it at this distribution center, and then the center then interacts with the schools to make sure that, say, there's enough broccoli for that school to have like a reliable source because several different producers are kind of buying into that or sending their food to that distribution center. Does that make sense?
yeah.
And so I guess my question maybe, and I don't know if you could speak to like what responsibility then should that distribution center have in terms of sort of vetting the safety of the farm so that the schools come and they just know they're getting food from this place that's safe and I mean, I know there would be insurance and things involved, but
Yeah. I mean, it's in my mind, it seems a little similar to like a farmer's market coordinator, you know, to kind of look at what their producers are bringing, what their practices are. And from what I understand, I think there are some guidelines for farmers markets to look at, you know, producer safety and practices. So that might be a resource.
And I think also that Julia Earlbaum and you heard the presentations this morning about Food Hub, and that's another question we can pose. What I'm thinking about is taking some of these questions, getting some good answers, and on coprevent.org posting Q&A, you know, as we research this stuff, but specific safety on food hubs is what you're talking about, the safety obligations.
One of the things that I've been working on at Weld County is understanding that food safety piece and how it would apply to a food hub and how it would apply to the producers. And there's a couple things, see if I can catch it all. processing or if they're just going to hold and distribute, just an aggregation and distribution, they would have to have a wholesale food license because they're aggregating many different sources and then distributing out to there. And it would be their responsibility to work with the farmers to make sure that they have food safety plans in place, if that's what they're going to require from them, so that way when an institution, whether it's a school or a restaurant or a grocery store, buys from them, they have to buy from an approved source. So that food hub will be able to be wholesale food license, it's a registration, so that they can show the institution that they are an approved source. So when the local health inspectors, because the local health inspectors only inspect at the institutional level, the grocery store, restaurant, hospital, school level, and they go in and they ask them, where did you get this from? Well, I got it from XYZ Food Hub. Well, is that an approved source? So you can trace back, you can go backwards to that. One of the things that I'm working with Julia on through the health department, and I contract with the health department, so I've been doing a little bit of contracting separately from the health department with Julia for the food safety piece. And the health department did producer forums. We did one in Weld County and one in Larimer County, talking to them about food safety. And just if they want to move into this area, if they want to expand into these institutional markets, talking to them about the food safety piece. It's interesting because there's a little bit of difference between the two counties. Larimer County producers, as a whole, the ones that we met with, they don't really see a need to do a food safety plan at the farm because they can sell direct to consumer to the farmer's market or through the CSA model, and they don't have to have anything, and they make top dollar for that, and it's a lot less work for them to not have to do a food safety plan, and so why would they want to go sell to these other ones who are going to require them to have a food safety plan? If it's one of those institutional markets, say a restaurant was the phrase that I heard a little more than anything else. If a restaurant asks them for a food safety plan, they'll go find somebody who doesn't ask for a food safety plan. Because there are restaurants who aren't asking for food safety plans from these small producers.
Our farmer that we have is in Larimer County. He produced 90% of the produce that we use. We serve about 14,500 meals a day. And he provided us with a food safety plan. And we've been to his farm and he follows it. So,
and some farmers will do that. Produce, there's no regulations that says that they have to have a license farm.
yeah, we still have to supplement. He has 13 acres. We can't.
And so there are some who are willing to take that step and have a food safety plan. They're operating, no one is going to operate with the intention that they want to make somebody sick. So they're already using food safety practices. They may not be documenting them. They may not have evaluated them to see if they can do something better. But they're not intentionally trying to sell something to make somebody sick. So we have to make sure we understand from that point of view. Well, because we need to make sure we think about it. They're just because they don't have it documented doesn't mean that they're not doing things. So I want to make sure to be clear about that. It's very intimidating for a small farmer trying to figure out how to comply with that. So that's one of the things that the health department and Julia are working on, is to do some food safety training with them to help them come up with a plan and understand how to write a plan so that they can move into these other markets besides direct to consumer. If you're not asking for it, they're not going to do it.
Yeah.
So that's one point of it. And I know that schools have their own CE HACCP plan that you have, so that you have to document it that way too. So food safety regulations are like an onion. There's lots of layers to it, and the closer you get to the center of the onion, the more localized, there's GAP requirements, voluntary GAP guidelines that would be like outside of there, the onion for produce. And then you take peel off that. And then there's another layer, if you're gonna sell direct to consumer, there's not any except for eggs, which with the Cottage Food Act, that would be exempt if that was passed. But there are some things that would be exempt if it's direct to consumer. If you're still going to institution, you're not exempt from that. So we need to make sure that you understand those differences. So there's different, the deeper you get into it, where you are in the scale is going to depend upon the depth of the regulations that are there.
Who do you work for? What is your job title?
Well, I contract with the Penny Health Department, Health Education Division. My business card, business card title is that I am active community environment technical advisor. But I am moving more into the food safety part with our food hub project, trying to understand the food safety piece of it, to try and help our producers understand where they fall in and what they need to do if they want to jump in. We've had producers tell us they're not opposed to getting a food safety plan, but they have no idea where to start. And
we've listened to
so we're looking at developing.
You heard Trista today from Durango, and we've heard her a number of times at directors' conferences, and she's been doing this for quite a while. And I personally have known, listened and watched some of the steps, and it's been a long time.
It
to
does.
get there.
It
Because
does.
farmers are not, that's not what they're used to.
Right, and nobody's made them, they haven't had to do that before,
Right.
so,
It's an unknown to them.
It is,
basically.
it really is, and I've never written a food safety plan, but I've been studying this and trying to figure this out, and I have a better understanding of what a food safety plan would take, and how you look at it, and from the water point of view, you look at what you grow and how you water it, how you irrigate it. If it's corn and you surface irrigate or you subsurface irrigate, that's a pretty low risk, so that would be the crop that you would evaluate. When you look at the different things that you grow, the different crops that you grow, you pick the highest risk one, and you write your food safety plan around that one.
You work for basically Well County and Laramie County?
Just well.
Oh, just Well.
So essentially, it would be great if they made a template that farmers could use to start a food
I think that's
safety plan.
There's several of them out there.
It's starting to happen, yeah.
Well, there's several of them out there. Penn State has a great food safety plan that's online that is written for the farmer, how to create a food safety plan. Cornell University has one. I read the Penn State one. I liked the Penn State one until I figured out how to find the Cornell one because I've heard about it and people talking about it. That's a great one. It takes a little bit of digging to find that plan. It's more involved, but what it does is it starts out with a checklist that says if you irrigate, so how do you irrigate? And you go through a series of questions. If you answer yes to any of these, then it says, okay, you need to develop a plan. Your plan needs to include something about this, and walks you through and refers you to the next document that can help elaborate on that. And it does that for each of the key parts of the food safety plan that you need to develop.
Well, what about the liability? Wouldn't that be?
That was going to be my question. All this is going to lead to liability. Heaven forbid if we have an E. coli breakout, because it's going to kill the little ones. So who's liable, and who's going to get sued, and who's going to,
Like
take
on
the
Trixie's
farm?
farm, if it's around how do we know it wasn't that they didn't wash their cantaloupe skins and now they're liable? I mean, so.
Well, see, they did wash the cantaloupes, and that's what caused it. It was a
Because that's-
man-made device that
But
they
as a
bought
consumer,
that caused,
But if you have bought that cantaloupe and you didn't wash the rind, where does your liability end?
Well, that's the question again. Where does it start? In the cup? Is it inside? Is it on the outside? No one has an answer yet, And so, but it's like getting drunk. Who are you going to blame? The driver, the drinker, or the company who made the liquor? I mean, and that's
Well, I
what we're
think
getting into.
if when I was reading through the guidelines that I was looking at on the GAP recommendations, a lot of it was, you have these plans in place and you have this documentation, then that relinquishes you from some of the liability because you say, look, I did exactly what the best practice is. That's how they sell it if you look at that document. If you're not doing any of that, I think you're more vulnerable.
Well, yeah, I think documentation is great if it's
document
It's
it
not
correctly.
going back to her.
But when it involves lives, someone's going to pay
Yeah,
it.
we have a food safety plan,
Yeah.
schools, we have HACCP, we have to document. That's not every restaurant or.
No, not even close. No.
That doesn't assure that you won't have
Very
that either.
Exactly, so that's back to the liability, who are they gonna?
But, typically liability is.
Minimize risks, so I guess that's one thing to be.
Yeah, and it's tied to intent. Were you grossly negligent, or did you do the best that you could? And I think you're less vulnerable doing those things. And I mean, I don't think you can think of it as I'm going to document everything I do, and that opens me up for more liability. I don't see it that way.
Obviously, Jensen Farms lost a lot of business from this. What is their liability, and are they going to be liable for it?
I don't know a lot of that. I mean, I know there's lots and lots of litigation that's going to happen. It will all come out in the courts. I mean.
But see, this is a good example of trying to do a good thing going bad. I mean, they bought this mechanism, this machine to wash the cantaloupes, but it was contaminated with E. coli. So,
Listeria.
it's just, or listeria. So, I mean,
Well, it could have been it was also in the soil. So it could have been that it was introduced from the soil onto this machine and perpetuated because of the. Yeah, I mean, we don't know, but.
Well, I went to a food safety training about a month ago, and there was a guy there who spoke, and I don't remember the details, so I'm not going to speak to the specific details, because they did talk about Jensen Farms. One of the things that he said, and he made it very clear, he had a PhD, so the doctor, he had 20 or 30 years in food safety, and running farms, and those kinds of things, is that the bacteria, there were two different kinds of bacteria on the cantaloupe. They had mutated from what they were because they had learned to adapt to the conditions that were there. So
There were 4 strains.
right, so there was a lot of different things going on. So what I remember him saying about this, the Jensen Farm situation, is it was sort of a perfect storm of events that came together. It wasn't one thing. They were doing things, but there were other things going on that were going on besides what they were doing. So there was a whole lot of things. It wasn't just one bacteria. It could have been affected, or could have been remedied if they had washed their candle. There was a lot of different things going on. And
There's even been, lots of scrutiny on the third-party auditor, which tells me they overlooked something and gave them a clean bill of health when they shouldn't have. So something was going wrong. I don't know the details, but I mean, I think you're right. There were several things that went wrong and several things that could have happened differently. And for that reason, then, they probably are going to be, exactly. I mean, and some of it's hindsight, some of it's, well, gosh, who would have thought this would, all these things together would have resulted in the biggest outbreak in 25 years.
I know it damaged it, but I think the other ones will come back, Jensen Farm.
They're going to change their name.
Moved to Argentina. Moved to Argentina.
Yeah.
I guess I've got a question/statement. I worry about the farmers being pressed too hard in terms of their paperwork, what they have to do.
Because we're farmers.
They'll quit.
Yeah.
Well, that's basically
And-
what Trista was saying many years ago when she started. She said, I don't press them very hard because they really they don't know enough about us and.
And we're the demand and they're the supply.
Exactly.
And we want to make sure that we maintain
Yeah.
a good
And they're
relationship.
small.
I guess I'm pushing
Yeah.
for real foods and CPHE in terms of GAPs. Can something be done collectively well so that they can actually perform to the standards that schools need? But not make it so overly They've got H2A and a whole lot of other issues with labor coming up the pipe.
Yeah.
And more paperwork for them is shutting down the small farms.
Well, what's H2A?
They're migrant workers.
Oh, okay.
Well, then even the organic, to become organic is incredibly difficult.
Yeah, it rots overnight.
So I just propose that.
That's a great
Taking
point.
that back.
Absolutely.
Keep it as simple
And
as possible.
the gaps don't come from us. We don't do it. It's more Department of Agriculture. But just to hear that thought, I think it's a really good one to all kind of keep in our minds and understand that we want to support. We're here because we want to support local agriculture, and we can't do that by over-regulation or even over guidelines or whatever it is. But at the same time, there's a balance because we have to be able to do trace backs and have the assurance that the food is safe. I mean, there's so many things kind of that have to come together and.
It goes back to, there is no malicious intent.
Right, absolutely not. But there could be from an outside entity, and that's something that we have to consider too. How do we make sure that they're checking all those? We have a checklist on those sorts of issues. We don't look at farms, but we look at a lot of different agencies that we do, establishments that we do regulate, as far as their vulnerability to some sort of intentional act. So, I mean, there's just so many things. Go ahead.
I guess I'm concerned too. I mean, I'm impressed by so many food service people who are gung-ho about it because where we live, I mean, there's a lot of resistance, and the fact San Luis Valley, and so the fact that you said, the fact that you said you go to the farms to check their practices. I mean, if that was something that was our food service directors, if that's their responsibility to go and evaluate the farms for safety before they decide to order from it, I mean, I don't see that happening.
No, but I gotta tell you, I'm a food services director, and I don't know how to run a farm. I don't know how to do all the farming. I don't know any of that. So it has to be someone in my behalf to do that. I mean, we can go check for cleanliness and that kind of thing, but there's so many practices on a farm that are so I mean, I went to see cattle a couple of summers ago.
Well, and I guess my question is what is the in-between? If you're going to, because this is fairly new to me in this much detail, but how do you, if you're going to get food from a small producer, what is the procedure? And what
Make sure they have a bathroom.
Conversations with our schools and the farm. I mean, I don't know. In terms of safety,
A lot of times it's having a relationship. You meet the farmer, you get to know them, and you discuss what you need or want, what they need.
And so far, that's happening with the rural schools, like you guys.
Right.
They haven't come to us. I don't know who it goes to. I have
I
friends.
anything over there, Gene, anymore.
Well, we don't have any but what I'm saying is that Jefferson County, when she's gone, but Jeff goes in the same situation. There's so many of us that we don't live in the rural communities that you guys do. So they know they're farmers, some.
Our farmers' kids go to school districts.
Yeah.
So,
Move. Yeah.
And then, you have some
No ties, a better idea.
and I think we're trying to facilitate, our local food coalition has like a committee of the food service directors who are at least willing to discuss the idea of it. And so I would imagine that at some point it would be bringing in farmers to talk about it too. I mean, we're in very early stages
So
of trying to.
And
We all.
in the last couple of years, we team up with our co-op. 13 districts in our co-op, including Cheyenne and us, and all of us down in Northern Colorado. And we put out a bid. And people bid, and we chose whoever we wanted to, who was closest to us. One of the farms that bid with us bailed out in the first month. And they are one of the biggest producers in Northern Colorado. So,
Why did they bail out? Because of the reds or?
It could be a million things.
there could be many things, I don't know.
The Andersons are trying to find out why.
Well,
Because they're not being on the paperwork or whatever.
No, and I don't think it is, because they send produce to our distributor. That we get produce from.
I think it was time.
I think it was the time. And, you just have to do a bid, you just have to sit here and
Last year we had built a 22-foot geodesic dome in Dillon Valley at an elementary school.
Wow.
Yeah, and we're still this close to getting the CO. It's taking way too long. But anyway, so we're going to start growing this spring and all. We are going to be experimenting for the first year, just growing herbs and some produce. But again, in the elementary you know, the whole question of liability and safety, even though the dome is landed a few feet away from the cafeteria, so you don't have to transport it that far. But now it's coming up a lot, you know, just the question of liability and safety of how do we safely get the herbs and the produce from the dome into the cafeteria. And there's just now a number of people saying, oh, we can't do that, you know, this and that. So I just want to go back to them and tell them that it's really safe and, you know, they just want to make sure they're not going to be liable if something happens.
Yeah, that question has come up a lot, is, you know, the liability of what we're doing, and you know, the more that we document, I think there's some concern that does that open us up for more liability. You know, I think that the more that you're able to show that you're trying to meet things that are considered best practice, the more you limit your liability. So I don't know, I mean, I don't know the specifics of your...
So I suppose there's no like set of rules or guidelines of this is how you safely get produce from a greenhouse or you know, their school garden into the cafeteria. Do you know of any existing guidelines like that? Because even if we had that, I mean, maybe that would reassure the school board that, you know, we are doing it safely. I mean, I know, you know, we have a steering committee and we're very, I mean, of course, we're going to be very intentional and make sure we're practicing really safe, you know, doing everything safely.
Mm-hmm.
But, yeah.
Joanna, have you been in touch with Denver Urban Gardens
On
this specific issue? Because they recently issued some kind of protocol where they've got more technical assistance documents, so Shannon Spurlock, I should talk to her directly. And then the other thing I would do is talk to Andy Nowak, who's here from Slow Food Denver, and he's on the Farm to School Task Force, only because he works so extensively with the gardens in DPS schools, and I know they are bringing some produce into the schools for cooking. And then I can have the law clerks I referred to in my presentation, this issue of, is there any legal difference between, you know, bringing it in from the greenhouse versus a garden, and do some research on that particular issue. But I think you might get some guidance from Shannon and Andy in the interim while I'm cooking up something.
Thank you, that's great, I will follow up with them.
Any other questions or thoughts on?
The herbs cooked.
The original plan was just to initially use the herbs and flavors in the food. There's so many complaints, it's a big Latino population there, student population, and so many complaints from parent kids that just aren't eating the food, regardless of if it's healthy food or unhealthy food, because it doesn't taste good and it's not cultural, they don't cook it. So one of the suggestions we got was to grow herbs that are culturally appropriate to flavor some of the foods that they are. So we bring in dry herbs. But then I don't know, I mean, I'm sure they might.
Because if you had an intervention step, and that would be, you know, either a rinse or a cook step, or you can just show it to the school board that this is your intervention for your food safety plan and everything. But I'd still go in with the other places. But if you look at what your last thing and your attorney will tell you, what you really have to do. But I would say if you have an intervention step, would that not be it?
I think you're right. I mean, anytime you have a food product that's going to be further washed or cooked, you know, then that's like your more of an assurance. If it's something that's eaten raw without further preparation, then, you know, that's when I think the transport becomes more of an issue. Kyla, do you have any thoughts on any of that, or?
I mean, I think that it would depend on what you're doing with it. Because I would imagine some person would cook and some maybe wouldn't. So, you know, just based on what you said, it doesn't sound like it would be really a food safety problem to go out there and greenhouse to the school.
Yeah, I agree. And Kyla works in Boulder, so.
Yeah. Well, it's funny because honestly, this is the safest thing we can do.
Right.
Safest. Yeah, I mean, the farmers, the growers, the gardeners, we're safe. I mean, but we have to, but it just takes one person to say, oh my gosh, like, what if you have one of those gardeners, they don't know what they're doing, this and that, what if our kids get sick? So, it's a lot of education on my end, it's a ton of education, and
Last year, you had some troubles, or some questions, you would say, with the fire service and safety. Has that all gone away with the greenhouse?
For the most part,
Good.
yeah. We were able to grow.
It's kind of a whole cultural shift, I think, and people who are reluctant, I just think need time and, like you're saying, education. And we at the state health department, we don't want to be barriers to any of this, but we want it to happen safely. So we're going to maybe have some off the wall questions or whatever. But I think mostly people want to work through it. They want to see healthy foods. They want to see local foods in the schools.
And would it be, I just thought this, would it be a good idea maybe call the environmental health manager of the county? Do they have anything to do with?
Where are you again?
Summit County.
Summit.
So they have
Yeah, absolutely. I would. Absolutely.
I don't know if there's any health department guidelines, but maybe if, he works with us, then maybe
Good.
the school district would feel more comfortable.
Well, I have a question sort of related to that. What's the difference between a HACCP plan and a GAP plan? And do both of those apply to the farm product? Just like the GAP plan for sure does, because you're asking about clean water, and pesticides, and water, and all that kind of thing. So could you explain the difference between those two? And wouldn't you have thought that even though you had this contamination at Jensen Farms, aren't they a large producer, and wouldn't they have had a HACCP plan or a GAP plan in place, but they didn't follow? So, I mean, you can have a plan in place, and then you could not follow it.
When I was in the Institute for Producers, just the last session, they were talking about how gaps, or HACCP is for processing food. So, gaps are for just growing food in the field. And if you're just growing it, harvesting, packing, then you're following gaps. And if you're now going to make some other product of that food, you're going to be cutting, slicing, dicing, cooking, packaging in some other way, then you have to follow HACCP plan, which is more extensive.
And that would be then at the school food service site, that they would follow HACCP.
We have to have a HACCP plan, and we have to have anyone we buy food from where it's processed, they have to have a HACCP plan. So.
Okay. Okay. Thank you guys. This was great.